and thank you for tuning into the Optimal Health Program today. Hope you're all doing well. Here I am with the great Frankie, our producer,
Great to be
holding
here.
everything in place, making things work. Where all this insanity going on around us. One of the big platforms just dropped temporarily, and we're kind of working through our friend Jeremy, and hopefully he'll be able to get things back on track. But this is what happens. Electronic stuff, goes on the fritz.
It's a matter of time,
We should call him and tell him just unplug everything, wait 20 seconds, and then plug back in. Because whenever I lose, my phone goes crazy or something goes crazy, unplug and replug. It's one of the absolutes of electrical function of appliances. We have some really cool stuff to talk about today. I don't want to scare you, but I do. We'll talk a little bit more about Lyme disease. I went to an amazing conference on Lyme disease in Philadelphia at Drexel University, doctors from all over the world, and Harvard and Tufts and Yale and research, blah, blah, blah. Really, really cool. Nothing really scares me except something like this. And we'll go over that and go into that in depth in a minute. And I'll tell you everything that was discussed at the conference. It's pretty wild. And it's tough to take to heart. We had a wonderful interview with Dr. Broscano a couple of weeks ago. We've replayed it so people can understand the significance of it, but this is more hardcore research on Lyme disease that everybody needs to know about, especially now between April, May, and October. But we'll get into that. I'm going to talk a little bit about low-carb diets. One interesting study from a very well-respected peer-reviewed journal, which I will not name, talks about the benefit of low-carb diets for type 2 diabetes. Of course, you bring less sugar in. You don't need as much insulin. Your sugar comes down. You burn cholesterol, triglycerides better. But one of the comments that they made there, it still is not as good as a high-carb diet. I'm like, how can you be so ridiculous and say that low-carb, which obviously makes all the sense in the world to be good for diabetics because you're putting less sugar on board. And we've done this. I've done this for 37 years with patients with great results. It's not as good, for long-term as the high-carb diet. This just doesn't make sense. I think that traditional medicine doesn't want to give up things that they've been saying and pushing for so many years. They don't want to look like what they've recommended, isn't good or hasn't been working. And, Dr. Atkins, rest his soul, great guy. We used to go to his office every first Monday of the month and, chat and talk about protocols and things. They attacked him viciously for the low-carb diet over so many years. And look, what are all the diets now? Low-carb diet. Even as far as going to carnivore, where people just eat meat and they talk about how wonderful they feel. So I think low carb has always been a great idea. And then once you correct your vitamins, minerals, hormones, you do your exercise, everything else comes on board. Today we'll talk about methylene blue, some of the other important components of enhancing your body's function. NAD we'll talk about today. So that being said, I wanted to jump in about Lyme disease. So the International Lyme and Associated Diseases Society, great conference, a real eye-opener to a lot of the doctors in the audience. It's a big audience. So some of the statistics that I'll talk about right off the bat, they believe that 500,000 people every year are diagnosed with Lyme disease if the appropriate testing is done. We'll talk about that too. There are people that do not get the bullseye rash. So they don't know that the tick has been on them and left. They don't know that the tick might have left the spirochete because the creature can live in the saliva of the tick. They don't know that 40% of the time, another bug is there along with the Lyme creature. So when doctors see a patient who says, I don't feel that good, I'm achy, I'm tired, a little sore throat, blah, 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 they don't tell the doctor about a rash. Doctor says, just take some anti-inflammatories, take some, I'm not going to say take vitamin C like I would, but they'll say, do this, do that. If the sore throat's persistent, they may take an antibiotic for a couple of days, which would never kill Lyme anyway. Historically, we thought that the creature has to be on your body for 72 or more hours. Now that's not factual. We know that the creature, if the spirochete is in the saliva and they get on you and they bite you, you wouldn't feel it. They can leave that creature, and now you have it. So it's not as though the creature has to be there for a long period of time to give you the spirochete. Children that are affected and are exposed really don't explain what they're going through. They may be tired, achy, etc., sore throat, but that's the same as everybody else who can have a little bug that may not be thought of as Lyme disease. So I think the numbers of 500,000 are dramatically higher, maybe even twice as much. So now let's get into the testing for Lyme disease, because everybody knows the symptoms are headache, flu-like symptoms, aches and pains, problems with memory, focus, people sleeping a lot. The original test for Lyme was created appropriately back in the late 70s and 80s, because in 77 we figured out there was this bug that was causing all these weird things to people. And I'm going to tell you right now, that's not the first appearance of Lyme in the world. We'll talk about a cool comment there. I know Frankie's smiling. So
I'm excited.
yeah, so the initial blood test was done to look for antibody bands, trying to bind to the bug. It was never a bug test. Like a throat culture can swab or a wound culture can look for a bug. You're looking for antibodies. But that initial test didn't have all the right antibody bands in there. The most specific for Lyme, that creature, was the bands 31 and 34, and still is and always is, but it's not in the tests that are done by the regular and the routine big labs. So you could do that test within 3 or 4 weeks of the exposure of the tick and see nothing, but you still may have Lyme disease. It probably takes 3 weeks for the antibodies to show when you're exposed to Lyme, and this has been in history, medical science for a long time. So doctors are told, well, if you have a tick or if there is a bullseye rash, start treatment and then wait a month and do the blood test. Okay, but if you're not doing the best blood test, you're still not going to see what's going on, and you may not treat appropriately. When doctors see a patient who has a tick bite and the patient throws out the tick or etc., they give them 2 days of an antibiotic. Completely, I don't want to say worthless, but it's not going to do much, because if you do have that bug, you got to treat for 3 weeks. That's the latest research, the latest guidelines. So there are tests done by a lab in California that's a specialty lab for this, and that will do a variety of tests, not just the ELISA, which is a simple test, enzyme-linked immunosorbent assay, which is not really accurate at all. So it's a waste to do the ELISA test. If you're doing the regular Lyme test, there may be other bugs that you're exposed to that you're not going to see because you're not looking for them. And the number of different Lyme organisms that exist, and I popped this up on my phone because I wrote it down on my pad here, but my handwriting's so bad. Borrelia burgdorferi sensu situ is one of them. Mayoni, Americana, Bavarensis, Andersoni, Japonica, Lusitanii, Bissetti, Spielmani, Californiensis. I said Mayoni. Spielmani. And then there are others that are in Europe, Guarini, Afzelli. So there are lots of different bugs that will give you Lyme disease. But if you're only looking at the first one, because that's the blood test that was made back in the day, then if you have the others, you won't see them. Does it make sense when a doctor sees a patient to get a Lyme test done? Yes, but with my thought process and talking to the doctor, we're giving the lecture, we had a nice little discussion. If you've been bitten by a tick, if you have the tick, you can present it, give it to the lab, they can test it. If you don't have the tick, okay. If you have been bitten by the tick, you need to be on the antibiotic, doxycycline, I would say for at least a week or two. And within that week or two, you have to test for the Lyme organisms, because when you're on the antibiotic, you'll be able to capture a positive test if you have Lyme, because the antibiotic helps to attack the bug, and you'll be able to see it better on the blood test. You could repeat again by the 4th week or the 5th week. But my comment is, if you're doing a regular test for most of the labs and it's not terribly accurate and you're not going to get all the other strains, then you really have to send that test out to California, which is what I've done for years and what we do. So a doctor has to think, well, we can do the local test at the local lab, but we still have to do that better test to look for Babesia, Ehrlichia, there are Anaplasma, Bartonella. There are a lot of other organisms that come with Lyme at the time of them coming into the tick when they're exposed to it, when the tick bites a mouse or some other crazy little horrible woodland creature. So these things can get into your body. So that's why a lot of people that are treated with a couple of days or a week of antibiotic down the road, they're much worse. Sometimes if a doctor gives you a steroid pack or a pill or a shot, that can make the Lyme flourish more. And we're going to go into in a minute talking about biofilms, which is really going to blow your mind. So it has to be a very specific way this is done. In the Lyme world of doctors that are really good at Lyme, they call it Lyme literacy. A Lyme literate doctor is a doctor who's taken the courses and done all this.
Well, I just want to point out, because you just mentioned biofilms, I just want to shout out to our genius audience, because someone already asked about biofilms.
Really? That's pretty cool.
Someone said, I've heard Lyme bacteria can hide in biofilms and become resistant to antibiotics.
We'll talk about that specifically in just a few minutes.
Look at you guys.
And that's going to blow your mind, because even I wasn't aware of how that transpires. You hear about it, but then when you see it on studies at the Lyme conference and you see how they test for it and all of this, you think about something that, well, maybe, and now it's an absolute. So it's pretty crazy. So you have to do the testing for all of the other bugs when you're doing that test to be able to see the 31 and 34 band, which is the most specific to Lyme itself, all the breakdown, the different Lyme bugs, and then the other cofactors. So important to look at all of that. So Lyme is not something where you can just say, okay, hey, let's give a couple days of antibiotic and you'll be fine. I don't think that's ever really been the case. So very, very important. October, there's another big international conference, and thankfully it's going to be in San Antonio, I'm sorry. Nothing against Philly. It's probably a very nice place. And I imagine we have some people from Philly in the audience. Don't want to disparage anyone. But maybe it was a cloudy day. The area that I was in, it wasn't exciting. I didn't get a chance to go down and look at the Liberty Bell, but San Antonio is a lot of fun. Amazing breakfast tacos, great food. I have to go see my uncle who lives down there. Uncle Gene. So we're going to do that. And then obviously get through there's a whole process to get, certification and such. So, but I think it's good to take these courses and learn as much as you possibly can. So let's talk about biofilm, which again is a very strange circumstance. So tomorrow we may have films on this just to show you what this looks like. But a biofilm is a community of microorganisms embedded within a protective slimy layer, a matrix of sorts, attached to the surface, attached to cells, attached to organisms. This matrix, primarily composed of extracellular polymeric substances, shields the microbes from their environment and the host's immune system. Biofilms can be found on various substances, including natural surfaces like teeth, medical devices, catheters, industrial or aquatic systems, but they inhibit your body's ability and medication's ability to attack and kill bugs. So,
how convenient, this dang bug.
It's amazing to me that this sort of thing exists. Oh, hey, look, here's a bunch of guys hanging out, and they'll just cover you up, and now the antibiotics won't kill you, so now you can kill the host. You can kill the person. It's crazy. Crazy but true. And every time we dig deeper into a layer of understanding of the human body and what's going on, it just constantly amazes me. Now, there are nutrients that help with biofilm. There are intravenous vitamin therapies that can help with that. So now the mechanism is, and I think there's a lab that one of the doctors was talking about to do testing for biofilms. We can test for that, see if they have any significant effects, and then pre-treat patients with some of the combination nutrients, glutathione, potentially NAD, methylene blue, because they're great for mitochondria as well, and then use the antibiotic and then retest. So it's a little bit of a back and forth, but the idea is that keep checking to make sure what you're doing is working. And there are a lot of people, and they showed some slides of some really lovely kids who ended up having Lyme that ended up with really bad neurologic disorders, had more of a chronic stage of this because it wasn't diagnosed within the first year because the doctors were doing the basic tests. And thankfully, they ended up doing really well because of the doctors who published these articles in this organization and who really know how to treat these patients. So, now I have all their secrets, and we'll be doing this as well. But pretty amazing this whole weekend. Now, I was telling Frankie before, I left the conference at Drexel and I was walking along this one street. I didn't realize that the place where they had the conference was a block and a half from the hotel that I stayed at. So I rushed down there. I took a car into the city, got on the Amtrak 6 o'clock train, got there at 7:30, rushed to the hotel, dropped everything in the room, ran out, got a taxi. I'm here, take me to this place. I get in the car, we're driving around, and you can't make a left here, you can't make a right there. It took 10, 12 minutes to get me to the conference at Drexel, which is literally a block and a half away. I didn't know that, so spent a little bit of cab money, giving back to the community, spent a little cab money for the guy, but I could have walked there in 6 minutes.
Oh, well, you know that.
Which I did on the way back. And
the cab driver's definitely like, oh, he doesn't know.
Yeah,
nice.
No clue. And when I walked out of the conference and I'm looking there and all this stuff is flying through my head and they were saying about, this and that and trees and grasses and bushes. And I'm walking along these bushes on the side of the sidewalk. I'm like, I took 2 steps, 3 steps away. I wasn't going to walk near the bush. I was going to walk near the grass. So it makes you look at bushes, grasses, fields, and other areas with a great deal more, trepidation. And I do gardening around my house. I have a lot of vegetation around my house. And there's one area where off of the deck in the backyard, a big sloping area, I put a whole bunch of big, rose bushes that get very bushy and stuff, and they need to be trimmed a little bit, and a couple of other big flowering bushes. And I called the landscaper. I said, yeah, I need you to do some trimming, because normally I would like to do that. It's fun. Deadhead the roses, cut the dead roses off. So now I'm going to let somebody else do it.
Yeah. Yeah. My poor Lola, because I used to take her to the dog park all the time, every week, few times a week. And then that one time I find a tick on me, and that was game over. Game over for me.
It's better to be more scared about this than it is to be lackadaisical about it, because you don't want to get a bug that can really, really damage your health. I'd rather be more afraid of it than not and just get exposed and then all of a sudden have to deal with a nightmare, coming up down the road. Same thing for your dogs. Golf courses, don't go into the rough. Wear big, high white socks. Just protect yourself so you can see what's going on. Now, the larvae of the bug is very tiny. It's like the size of a dot when you put an ink pen on the page. And that's really not infectious. The nymph, which is bigger, is the most infectious. It just goes out all over the place and tries to infect everything and everywhere. And then the adult, which is the larger forms, which you can see, but they're still tiny. Most people would never know they have it, and they're shocked to find out that they do. But you've got to question every patient really accurately and look for all of this. Okay, phone lines are open if you'd like to call in, 888-420-9272, if you'd like to do so, or just give us a text or an email. We'd love to hear from you.
Oh, we got plenty in the bank.
Yeehaw.
Yeehaw. Okay, so someone's asking, why do so many doctors follow a one-size-fits-all 1 to 2 week protocol when Lyme disease can vary so much from person to person?
Great question. I think 90% of doctors will learn about something and then just kind of stick with that, and they don't either take courses or learn more and do research and get on the computer and blah, 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 blah. And look, there are doctors who have a specialty, and they may know a lot about that specialty, but they don't go beyond necessarily that area, lungs or kidney or heart. But I think all doctors should be talking to patients about infectious disease, number one. All doctors should be referring to other doctors who specialize in infectious disease, or should be referring to Lyme literate doctors who really understand the entire picture. I'll tell you something. Every doctor I've spoken to since, I tell them, get online, go to this organization, iLads, look at the literature, look at the research, download some articles, buy a book written by one of these guys. It's fascinating to learn about this. And I'm going to tell you, everybody's going to have a family member that's going to have Lyme disease at some point. Everybody. It's everywhere. You can't escape it. So you really want to know and understand what this is about. It's the number one fastest growing infectious disease in the country and probably the world. So everybody should be looking at it and learning about it.
I had a tick bite and ongoing symptoms, but my primary care doctor told me I didn't have Lyme because I never got a rash or a positive test. How can doctors still be this behind?
I don't know. I've always, every day, get on the computer, look for some cool stuff to talk about with patients, talk about on my radio show for 35 years, talk about on the podcast. So I love looking at this stuff. Other doctors don't. They kind of have their brain filled up with info and they're just don't want to keep driving and driving and learning and reading and adding to it. I don't know. It's hard to say. Some people do one thing and they just don't want to go beyond that, and they're really missing a lot of what's going on. Like doctors who don't test, vitamins and minerals. They don't want to look at nutritional, mechanisms or vitamin and minerals. There's millions of studies on the benefit of the vitamins and how important they are to every part of your body and how they can help to prevent disease. So they just don't go beyond that.
I just want to say we got a Robert Moses comment. I go to Robert Moses Beach sometimes. I ended up with the tiniest little ticks on my leg. It is so scary how small these things can get.
Yep.
Like the tip of a needle.
Yeah, if you took your pen or pencil and you just hit it on the page, that's what the larvae and the nymph look like. They're so tiny, you might think it's a piece of dirt. You wouldn't know. And then if the tick sits there and becomes the nymph and gives you the bug and maybe sucks your blood a little bit, gets engorged, you might see a little bigger bug. I've seen them on my dog, Delilah, who loves to run around and explore everything she possibly can. I got to brush her all the time. She was scratching behind her ear, and then something popped out, and there's blood on the floor. I'm like, what the hell is that? It turned out to be a tick that was engorged. Fortunately, it was a dog tick, wasn't a deer tick, but ticks are ticks. I'm going to bring her to the vet in a week or so and just see what's what with her testing.
Brutal. Someone's asking, why do so many Lyme patients get told their symptoms are psychosomatic when in reality it could be untreated or misdiagnosed?
Yeah, because doctors don't understand. They think that, okay, here's a bug like every other bug, and you find the bug, you use the drug, and you should be fine. But that's not accurate. Oh, the other vexing thing is that the Lyme creature, which is a spirochete, a spiral organism, super, super tiny, has a membrane in a wall, but it can change into a circular component of that creature that doesn't have that membrane. So it's cell membrane deficient. So if you're using an antibiotic that kills the bug by destroying the wall or the membrane, like doxycycline, it's not going to work if that's in the circular deficient cell membrane stage. You may have to use cephalosporins or amoxicillin. So all this wild information, we discussed at length at the conference, which is it's amazing. But doctors sometimes just sit back and think of something they learned years ago and just keep putting that comment out.
Someone just saying, the CDC's official Lyme guidelines are still so narrow. That's why I think this government made it.
Hey, well, it'd be hard for the government to make it, for it to be all over the world. Oh, here's the cool thing. Remember Otzi, O-T-Z-I, the guy that was buried in the Alps, for 1,000 years or whatever it was, and he was a hunter, and I think he was killed by somebody, shot him in the back with an arrow, they figured out, because his body is almost in perfect condition. They found him in the Alps, and this is a few years ago they found him. And, they know what he had to eat because they checked his stomach and they had berries and, maybe reindeer meat or something. But Otzi is a very famous find in the Alps, a corpse. But they tested his joints. He had Lyme disease. Absolutely had Lyme disease. There are stories and proof of people having what they call Montauk knee back in maybe the early 1800s or maybe 1700s, and they kept the blood. Those people had Lyme disease. So is it the creature is exploding into the environment now? Is it because there are more people living and come in contact with the bug that we're seeing more of it? It's probably a combination of both. But very, very bizarre, very scary.
That's insane. How do you even?
Gotsy.
I guess
Good old Gotsy.
That's like the perfect. You're just stuck in an ice, perfectly preserved.
Perfectly preserved in ice, and then they've figured out all of this information from him. So people go online, look up Otzi, and read all about it. It's wild. I love it. I love stuff like that.
That's wild. And, the chat's just talking about how small these things come, the size of a pin. You can barely see them. Yeah, man. I looked one day after walking the dog, and I looked at my hand. I said, oh, what are these beauty marks? And I'm looking closer. I'm like, oh,
yep.
Those are legs.
When they put up a big slide on this gigantic auditorium backdrop on the screen, you saw two things that you say, okay, I mean, that looks like ticks, but when you saw the person's fingernail and a pencil in the picture next to give you references to size, you're like, wow, look how giant that pencil, sharpened pencil tip is, and look at the fingernail and look at how small even the adult ticks are. And then they had to point out the nymph and, of course, the larvae you couldn't see. So they had to point it out with a little pointer. And I said, gosh, you'd never know. You know what? And we say, God bless the people who have the rash, because then you have a quicker potential diagnosis, but you still have to treat it the right way and test it the right way. So you're very lucky if you have the rash.
Right. And it's just insane because, a lot of people in the chat are just kind of freaking out because they may have gotten a tick bite and,
Well,
they
got
were
to
just
retest it. And for those people who wanted to get tested with the lab in California, we certainly do that. So if there's any advantage for you to, contact us, we'd help you with that. Set up a consultation, get your history, get all the right testing done. I have a good friend of mine that's in my karate class, and he has a house out in Southold on the beach. Just picked it up a couple of years ago, redid it, gorgeous little place. He called me and he sent me a picture, goes, what do you think? And I wrote, yep, back in the text. Bullseye rash on his knee, you can't miss it. He said, he goes, I can't believe it. I said, yeah, you're in an endemic area. The whole country's an endemic area. There's probably somewhere in the middle of the country where nobody lives that you really don't see like a lot of cases of Lyme, but all over the place. So I said, I have good news and bad news. He said, what's the good news? I said, good news, we figured it out right away. You'll be on meds. And bad news, so we just got to keep retesting to make sure you don't have other bugs or, nothing else is occurring there. But crazy but true.
crazy. Of course, the Plum Island questions are coming in, Doc. I'll try to listen. Rumble's having some problems today. We gotta take care of our YouTube.
That's right. Our YouTubers, our TikTok, Instagram, Facebook, Spotify, everybody. All our friends, our extended family.
Yeah, you're good. Sorry.
Questions, comments?
Yeah, we got a bunch. All right, I'll just let him out. All right. If the military did experiments with weaponized ticks, would they ever admit it, or would national security keep those buried? That's not really for us to.
Yeah, I don't think anybody admits anything anymore. There are, and you can look this up, there were bugs that were tested on animals, injectables and tested on animals that were killing the animals. And the person who made all this and sponsored all this, in the guise of human safety and research, sent all these things to Africa, and people became sick and ill, and some died and some became infertile. But you could look that up.
Why isn't it called Montauk disease? Why did it make it to Lyme?
Well, because Lyme, Connecticut in 1977, there was a massive cluster of people that had all these swollen joints and aches and pains, and it was just bizarre. It kind of stuck out like a sore thumb, no pun intended. But that's why they called it Lyme disease from Lyme, Connecticut. It was called Montauk knee probably up until that point and back in the 1800s, because that's where they saw, outbreak back then.
Crazy.
So are humans encroaching into their territory, or are they encroaching into our territory? This is great science fiction stuff. Gotta call my friend and see if he could do a movie on this, a sci-fi movie.
Yeah, it's like there was that old Family Guy scene where there's like a few cockroaches, and they're going to take it out, and they just come in with machine guns and take out every drywall in the room. It's like, I think we got him. There's no cure there. Hey, Doc, I've had joint pain, fatigue, and brain fog for years. Is it possible I've had undiagnosed Lyme this whole time?
It's always possible, If you don't see this research, you think, of course it's very common to have Epstein-Barr virus. That's a fatigue virus. When you pick it up between kindergarten and college, you can feel wiped out. You can't go to school for a few days, sore throat, swollen glands, swollen spleen. So Epstein-Barr is probably the most common bug in the world because 90% of the world, not just the U.S., has been exposed to it between kindergarten and college. So we always test for that. We test for CMV, test for a lot of different things. But when you have things that don't make sense, you always have to test for Lyme, but in the right fashion. And we've seen that for a lot of people. I remember a guy, this is probably 20 years ago, who had anxiety, depression on tons of meds. He was miserable. I mean, I felt horrible for the guy. First consult, explaining everything. You know, and I talked to patients. I'm like, so when did it start? He goes, oh, you know, we were at a family gathering and blah, blah, blah. I'm like, what do you mean? Where? What? Blah, blah. Yeah, we were playing softball. You know, we were playing upstate and, you know, blah, blah, blah. And I said it was in a field. Yeah, I guess, you know, so describe what the place looked like. Oh, it's a beautiful place. Hills and beautiful and the woods, forest. And I said, you played softball, right? I said, did you go in the woods? He goes, yeah. I ran into the woods to get a ball, came back out. I'm like, okay. I said, I'm going to tell you something that you may not understand or realize, but we're going to check you for Lyme disease. He says, why? I've never gotten a rash. I've never had a tick bite. I'm like, those are not the absolutes for Lyme disease. So we ended up testing him. He had Lyme disease. We put him on the oral antibiotics for a couple of weeks, got better and better. At one point, because he probably had it for a long time, we had to put him on intravenous antibiotic, Rocephin, which you do a couple of grams a day, 4 days in a row. And we did that at his home, and he completely turned around. No more meds, no anxiety, no depression, no more neurologic symptoms. And that was a long time ago, and I was blown away. And honestly, I probably had seen Dr. Burskano in one of his lectures that he did out at either Stony Brook or maybe CW Post. And it just raised my index of suspicion. I said, this is weird. Can't figure it out, but let me ask him some more questions. And we tested him. So big difference in his life. World of difference. That's what you got to do.
Yeah, and it's funny because that was the next comment I saw in the chat on Rumble is just saying that they had a cousin who was being treated with depression and anxiety, and it ended up being Lyme. Crazy.
The literature's there. Everybody can read on this. Everybody can read this. You can go to ILADS, the International Lyme and Associated Diseases Society, and look at some of the books they have, the articles they have. Everybody can. Go look, read, learn about it. Ask your family and friends, and ask everybody about bug bites and tick bites, and just be very careful where you go and what you're exposed to.
Someone's saying 2 to 3 weeks of antibiotics sounds short for an infection that could spread throughout the whole body.
If it's early, this is what I'm saying, and again, the recommendations, if you have the bullseye rash, you just start on them, you check your blood appropriately, recheck, etc. There's a CD57 blood test that's done by LabCorp that's a good test to see if Lyme has reached that point where it's damaging your immune system, because it can. Bizarre but true. And I think most people are better off doing the 4 to 6 weeks. And you might need to use, depending upon the biofilm thing, different herbal combinations, IVs. You might need to use different antibiotic. If another bug is there, like Babesia, you might need to use another added antibiotic if they believe that bug has been there, for a much longer time. So we have to constantly test and retest and make sure we're getting the result we want.
Yeah, and someone's just asking what the correlation is with Babesia and Bartonella and Lyme, and just
so Babesia, Bartonella, Anaplasma, ehrlichiosis are all bugs that hang out in the same place, right? And when the tick comes along and bites some little rodent, which I don't understand why we have rodents in the world anyway. What's the purpose?
Let me know.
Sorry, rodents, but... So they're all in the same place. So if you bite something that's got these things in it, I think it was 40 to 50% of the time, they come along with Lyme. So you have to test for them. Have to.
My dog had Lyme. Should I be worried that it means there are Lyme-infected ticks in my yard?
Well, yeah, trust me. Look around your house. Look at don't go too close to the bushes. Look at every bush. Look at long blades of grass. Look at all this stuff. They're there. So if your dog's getting in there, which all dogs do, and maybe digging the dirt and whatever they're doing, you got to have them tested. You got to look at that because they'll bring it to you. They'll bring the bug to you. You won't even be able to see it when it gets on you. If you hug your dog, you squeeze your dog, pick them up in the air, throw them around,
And I see this a couple times today, but people are just asking, like, is it worth spraying poison to stop the ticks from being in the yard or to deal with them?
So I don't like the idea of the pesticides that are dangerous, damaging, poisonous, like those things that are still in the stores that you spray to kill the weeds that can cause cancer. Everybody knows what that is. There are companies that make chrysanthemum extract and flower extract oils and natural organic oils to spray around your house. And I've done this for years. I've been up in my house for a very long time. This guy, Zach, I think he's from Europe or Australia. I can't tell with his accent, but it's got that, hey, mate, sort of accent. Cool guy. He comes once or twice a month between these months that are the highest risk and will spray and, kill the mosquitoes and the ticks. So, but it's got to be an organic product. Aronica, Aronica, is the name of the company that he has. So I tell everybody, wherever you are, get your house sprayed. And it's fine for your plants and your flowers and everything else and your vegetables. So I would get the place sprayed.
Words of wisdom. Whatever happened to the Lyme vaccine? And is one coming?
So the V word.
Yeah.
They tried to make one, but I don't know that it had any legs, no pun intended. They used the 31 and 34 bands to use that to be more specific to the Lyme, but I don't know. It just never came out as a big, big thing. So are they going to make a better one? I'm sure. There are researchers working on this. They mentioned it during the conference, but it hasn't received the attention. And I think after what we've been through, people are not likely going to like that idea.
So why isn't there more public education about how easily Lyme can be missed, especially if the bullseye doesn't show up? This is insane.
That's hard to say. So a similar question, why don't they teach nutrition in medical schools? There's no real push for them to do that. They teach about every drug because the drug companies, want that. Why do they not teach really hardcore, heavy-duty, latest research on Lyme disease? I don't know. Maybe the departments of health just don't have the manpower or the ability or desire to do that. I don't know. People are asking great questions. Sometimes they can't be answered. And, and that's why, I like my crusade to talk about all the things we talk about, heavy metals and all that, Lyme disease, nutrition. More people, more doctors have to go out and talk about it.
Why are the baby ticks, the nymphs, more dangerous than the adults?
So the larvae are the little tiniest creations, and when they turn into the nymph, they become much more active. So they're constantly going out and searching for somewhere to exist and to thrive, and they'll jump on the back of one creature or another, the deer and every animal. They've been proven to be very, very aggressive and moving. So the larvae just sit there and hang out like a couch potato watching a football or baseball game. Not to disparage couch potatoes. But that is when it's most active between the end of April, May, and October. And then the adult is less active, but it's not as active as that nymph. Which sounds strange in that sentence because nymph may carry other meanings, but
you beat me. Pyrethrins.
Yep. Mm-hmm.
It's made from daisies. Just a comment.
There are different components that they use to spray, and there's DEET and OFF, etc. Some of the chemical components of some of these things you may not want to have in contact with your body, but I like the fact that the organic and natural, sprays you can spray around your house. Makes sense.
So if you pull a tick off quickly within a couple of hours, is there still a risk?
Always. So as Dr. Borscano said a couple of weeks ago, when the tick bites the creature and takes in the spirochetes and associated villains, it goes into their stomach. But then in no time, it can get into the saliva. When it bites you, it's in the saliva and you're getting it. It used to be thought it would take 72 hours. Now they're saying if it bites you, you're getting it because it's likely in their saliva. We don't know how long it has to be from their stomach to the saliva. Doesn't really matter. It's probably hours as it moves through their system. So that's why we're worried that any of the bites can be significant.
Someone's just saying, I feel like I should just be automatically getting a dose of antibiotics for this monthly. Lives in Montauk.
There are ideas, and doctors spoke about that. And I said, yeah, have a person come in, evaluate, test them. I think people should be tested, especially in those areas. And for those people who've never been out to Montauk, it's a gorgeous place. It's beautiful. It's old, a little bit laid back. But if you're driving down one of the major roads in Montauk or side streets and you look to the right, you could have a silverback gorilla 2 feet into the bushes and you'd never see him. Maybe an elephant. The bushes are so thick, you can't see beyond 2 feet into the bushes. They're just crazy thick. Not as sparse as we have everywhere else, but it's super thick. So these creatures thrive out there. There are a lot of deer out there. See deer running across the side streets there all the time every time I go out. So, they're there. So people who live in areas where it's, high risk, maybe once every couple of months you test those great tests out to California, and if need be, you take your meds.
We got someone just saying, after what they did with those COVID jabs, no thanks. Hey, antibiotics. Antibiotics.
Yeah, these have been used by billions of people worldwide without risk, unless a person's allergic to. But, yeah, that's a whole different thing.
We got some city dwellers asking if they should be worried about them.
Yeah, you'll find those bugs everywhere. Just because you live in the city doesn't mean that you couldn't have exposure. There are trees, grasses, weeds, bushes in the city, and there are animals in the city that can spread these things around.
And talk about the rats.
Yeah. I remember having a patient who, a very nice older gentleman, really never left his house that much. Would go out to eat, go to a coffee shop, this and that. He had a weird rash in his leg. He goes, I don't know where this came from. He says, a reaction to a food. I'm like, well, it's not really the blotchy reaction to a food. I said, and it's not a bullseye rash. And the other point that I have to make, because I forgot to make it before, is that you could have other types of rashes that are not a bullseye expanding rash with a dot in the middle that are Lyme. And he had a blotchy little pinpoint rash, and we tested him, he had Lyme, and we treated him, and he became fine.
Someone's saying, why are there so many new tick-borne diseases showing up beyond Lyme? Is something changing in the tick population, or are we changing? Are we getting weaker, Doc?
So the fact that we can test and find that more people have Lyme and the different strains in Babesia, Ehrlichia, Anaplasma, Bartonella, all of these things, I think most of these bugs have been here for a long time. Certainly, as I mentioned, with Otzi and Montauk knee. But I think there are more people encroaching into their space, and I think the boom of these creatures is going crazy. And, their rapid rate of growth and development is much higher than before. And I don't know exactly how to answer why there are so many more bugs now, but think of it. In 1960s, Lyme wasn't even a thing because it took 1977 in Lyme, Connecticut for that to be thought of. And then when doctors did more research, hey, there's another bug. So the more research we do, the more we find, which is important because now we have more that we could be able to understand and treat.
Someone's just saying that they always used Raid Flea Killer on my dogs. You can spray it right on the dog. It worked great. And on fleas and ticks, it contained pyrethrins.
Yeah.
It's a hard word for me. I'm just going to say daisies at this point.
Yeah, but the question would be, you could spray the dog a lot. If you don't spray around your house, the bugs are still hanging out there waiting for you or the dog. So I think it's important to spray the naturals around your house with some repetition. If you're going to be outside, you could use any of the sprays. There are different things that you could do. Some people use wristbands and such. But I think you want to keep your home environment as clean and as healthy as possible.
And someone's just asking about super ticks. Is this the same as the babies? They said they've heard about super ticks or tick carrying multiple infections.
Well, we're talking about ticks carrying multiple infections. And you could call the nymph sort of the super tick because they just go hog wild. They're crazy.
Right.
And if they bite one bug and there's 8 infections there at the same time, you're going to get all 8 of them. And I promise, as I did with Dr. Borscano, every couple of weeks we're going to add new information and explain these things to you because it's out there and all this is evolving. But this is cool, scary stuff.
And someone's just asking, what's the deal in the winter? Do they die off? Do they just hide?
They're not as active, but their activity level, the nymphs between April, May, and October is pretty strong. So they're in less number, although the male and female adults are around. I wouldn't go jumping into a bush in Montauk in any way, shape, or form. I was out of Montauk, it was a year or 2 years ago. I think it was last year, 2 years ago. I bought an e-bike because my friend Mike and I, we take our four-wheel drive trucks onto the beach right past the lighthouse, and we drive onto the beach a mile or so down there. You set up a little table and chairs and lay in the sun. We'll take kayaks, go fish, which I've stopped doing because I realized that that's the ocean. If you're going to go catch bluefish and put them on a little wire off the side of the kayak, that you're just baiting, waiting for sharks to come and say hello. And then I saw this thing in the paper that there are great white sharks out there. I'm like, okay, no more kayak. But we bought e-bikes because you can take the e-bike through a little trail through the woods, nice little trail, down to a big pond and go fishing there. You can get crab, whatever there, oyster pond. And driving through the woods, and kind of hit a little bit of a rock that was in the soft dirt, went flying head over tea kettle off the handlebars. Not totally into the bushes, but I was enough into the bushes to be concerned. And of course, I got out of the bushes, and I had worn long pants, and et cetera. And then just got down to the bathing suit and checked myself out, and Mike was checking me, et cetera. And nothing, strangely enough, but fortunately, I had no problem. I tested for Lyme anyway because I wanted to be sure, but didn't have it. But yeah, it was a little scary to go flying into the bushes and think, oh my God.
Glad you're okay, Doc.
Yes, thank you.
I read that the U.S. military may have tested dropping ticks from planes during the Cold War. Is this true?
That's an interesting comment. Someone said that to me at the conference. It wasn't a doctor presenting. But I said, that's pretty weird. But look, they've created chemical warfare, gases and sarin and all this other stuff, and heavy metals they've tried to use to kill people off. Why wouldn't they use bugs?
It's a slow plan, but it'll work.
I don't know. Anything's possible. Okay, let's shift gears a little bit and talk about our new RPM program, because this is turning out to be pretty awesome. And any questions you have about Lyme disease, certainly email me through the website, drcalapai.com. Call the office, 516-794-0404, 516-794-0404. The RPM program is great because it allows us to track and watch patients and look at their blood pressure, their heart rate rhythm, oxygen, look at their sleep patterns, how many steps they're taking during the day, blood sugar levels. So we're gathering a lot of information on all your vitals. And this has come in part from the telehealth mechanism I've been doing since COVID because people didn't want to leave their house. So we can do visits over the phone. Medicare primarily covers this nicely. And we can have a lab go to your home to draw the blood. And then when it gets back to us in 5 days, go over the blood work with you so you're still at home. We do all of this. Depending upon diagnoses, we can either get you a watch, a blood pressure cuff or a glucometer, or even a pill box that has morning and evening flaps to put your pills in, your meds. And the way that these things work, and there are other devices too, which we're evaluating to bring to the forefront, they connect to an electronic device called a gateway, and that will send blood pressure readings, the watch readings, your heart, your rate, your oxygen, all of these things, glucometer to the gateway and to our data collection so we could track to see what your numbers are doing. The beauty of this is it's the answer to people not getting to see their doctor for 3 or 4 months, and a lot of those people will have irregularities and they can't get to the doctor, or sometimes it's so bad they go to the ER for a gigantic, expensive ER visit, which insurance companies don't like. But it's a brilliant way to track your body, and if there's any abnormalities occurring, we get notified right away. We could call you, and we could have conversation with you any days of the week that we're in the office. Myself, I have a nurse prac and a PA, hiring another PA and nurse prac to do this. So you have connection all the time with us. You don't have to wait 3 months to see your doctor or ask a question or get some info. The beauty of this is if you start to have an arrhythmia, we are notified immediately. We could contact you, contact your cardiologist, your primary care, anybody, and get things, taken care of. So it's a great way to maintain and protect your health. As soon as this, and we're seeing lots of patients for this, is those established in my practice already, and then new patients we're getting from other sources that have large numbers of people that are Medicare, either at facilities, homes, groups, senior centers. So this is going to be a big rollout to evaluate and cover all these people. At some point, we'll put that together for non-Medicare, but right now we're doing it for Medicare because it's smooth, it's seamless, and it's working extremely well. So family members are encouraged to get involved and help and watch and et cetera. Coordinate with people. We can tell them how to do a low-carb diet and see how much better their sugar's doing. If they have an arrhythmia and we add a medication and it corrects that, we'll know right away. So this is just great one-to-one patient-doctor, patient-PA, patient-nurse prac relationship, so we could maximize and optimize your health. From that blood work, we could put together vitamins for you and create a vitamin pack specific to your blood test. So if you're a heart disease patient or diabetic, and I pick the vitamins and put them into a morning pack, and I pick the second group into an evening pack, and you need more magnesium and Q10 because you're a heart patient, or you need more chromium or something to inhibit glycation because you're a diabetic, I can do that. And this is never done before. We're creating the vitamins specific to your need and your requirement. So all of these things we're putting into place so that people have a far greater ability to have care and connection. It's all about connection. So that's essentially the project. So we have probably 100 some odd patients doing it already. They love it. You wear a cool little watch, and they're telling their friends about it, and it's good. It also keeps you sort of in track when you know how many steps you're taking, how well you're sleeping. If you have sleep apnea, we could figure that out. What your average blood pressure, oxygen, sugars are. It's just a terrific way to understand yourself and learn more about yourself and stay in a better zone.
Well, the chat's loving that. We got some diabetes and high blood pressure that are interested. Someone's just asking, I love this idea, but how does the remote monitoring work? Are doctors looking at the vitals in real time or just checking after the fact?
So the way that it works is that these devices are connected all the time to the gateway. So if you're wearing a watch now and your pulse is showing on that watch, I wore it yesterday. It's a very lightweight thing, and it looks really cool. It almost seems like it's a toy, but it's very, like an Apple Watch, thin and lightweight. You can track and see what your blood pressure is. You can see what your oxygen levels are. You can see what your pulse is. It's all real time. That gets recorded, almost like when you do an EKG, you're laying down on the doctor's table, and they're reading the electrical impulse. That is recorded on a piece of paper, but these, whether it's the glucometer, the blood pressure cuff, the watch, which has all the modalities in it, and it can connect with your phone. There's something about pictures and photos, and, it just seems like it's got all these amazing things in it. It goes to that gateway, and the gateway records all that, and we get that transmission. So we're getting it real time. And if, God forbid, you have a problem, we're notified. They'll notify my cell phone or the cell phone of the PA, the nurse prac. So we'll get that information exactly when it happens. Genius. Wish I would have thought of it if I was an inventor.
Genius. And someone's just asking, everyone loves the idea, but someone's just asking, how is my data protected? Is this going to end up at my insurance company?
It's all completely HIPAA controlled, so that information goes nowhere but to us.
There you go.
So that had to happen. And remember, if you're a company that can make these electronic things, that the first thing you do is create HIPAA compliance, because you don't want to set these things up, send them out there and say, oh, wait a minute, where's your HIPAA compliance data? And you don't have it, you're done. So all of this was created well before, and now this is, panning out. We've had a few people that have sleep apnea that didn't realize it, because when you're sleeping, you snore a little bit. Most people don't realize it unless they're snoring so heavily that they wake up or their partner tells them that they snore. But we send people for the home sleep apnea test, have diagnosed it, and now we're appropriately treating the sleep apnea. So it picks up other cool things.
Someone's just asking, do you take Medicaid?
Medicaid, I'm not sure whether that covers it, but I'll have to get back to them on that.
We'll get back to you on that. And we're live tomorrow, so won't be long. But if you want to reach out on the website right there, drcalapai.com, and just send out an email.
Yeah, that, and call the office, 516-794-0404. I've met with the people who make the devices, really, really nice people. And, you know, you could meet people and say, wow, this is really the job that they should be doing, because they're so thorough in putting this together. And, you know, I appreciate hard work, and I appreciate people that really can create a great thing. And certainly it's going to help my patients immeasurably and all the new patients that we have. So it was really exciting to see that. So I will probably bring the box of the different devices tomorrow if we can, and maybe we can do a little video of it so people can see it, what it looks like. And I'll wear the watch myself.
I like that. Let's do a little.
That
little
pill box
tutorial.
thing is cool too, because if a person is older and they need to take their pills and the family member helps to put the pills in the box, if Mrs. Jones didn't open the box to take her morning cardiac pill, we'll get a notification that it was supposed to be opened at 8 and it wasn't. Then we can call Mrs. Jones and scold her and reprimand her. And tell her she needs to take her pill. You got to joke around with patients. I have a lot of patients. I joke around with everybody.
Listen, that's what we need. I'd get rid of my doctor if he.
You got to have a sense of humor.
Yeah, I couldn't agree more. Someone's just saying, are older patients or lower income patients getting left behind in the telehealth? I will just say this: you're watching this. You know anyone who's older? We just want to get it in for anyone who can find out about it.
Well, older patients typically are Medicare patients, 65 and older. And Medicare loves the idea because they realize for the first time in the existence of an insurance company that if they allow these things to occur, patients will be healthier. Problems they have will be dealt with right away, not weeks later. They're not going to be sliding into a heart attack and then going to the ER for $80,000, workup. They'll have better, appropriate, earlier care, and maybe preventing that big problem from happening. And look, a lot of people end up at the ER and they have a stroke or a heart attack, because their blood pressure was too high, et cetera. Their oxygen was too low as a result of COVID and lung issues. All this is evaluated, and we can track the patient and protect them. That's the whole idea. And patients that have Medicare are those that don't have the wherewithal necessarily to get to the doctor, and that's why we send the lab to their home to get the blood work done. So it couldn't be easier. Mrs. Jones, how are you? Do a consult with her over the phone, blah, blah, blah. And then send the lab to get the blood work done, come back, look at the blood work. Another thing we're going to add locally, a lovely lady that I met with a few times, Amy, who owns a very big nursing business that sends nurses out to people's home to take care of people. They have lots of Medicare patients. I just went to a picnic barbecue they had the other day, and there was 500 plus people there from different areas, different backgrounds, different health care facilities, different groups, maintaining health. Some were from, adult home care facilities. They all love the idea. We did a video of it. And I want to be able to have her hire more nurses, so now nurses can go to your home, whether it's once or twice a month or once or twice a week. We might be able to do it where if you're already a patient of mine and we have the nurses go there, you may be able to get your vitamin IV done at home. So I've said this many times over the years that going forward, more of medical care and evaluation is going to be done at home, and telemedicine is going to be a much bigger mechanism than regular office visits, because not every patient has to go to the doctor for every little thing. You have something, a rash, you can show the doctor, take a picture, you can do a Zoom call, doctor can evaluate you, and you get immediate care. That's what this mechanism is all about. So I think this is going to dwarf a lot of the other, ideas in medicine, because it's what people need and want.
It's amazing. People are just saying, I'm never going to have to go to the doctor again. Hey, listen, it should bring down the amount of
Once
visits.
in a while to do your exam, to have the doctor listen to your heart, lungs, maybe do echocardiograms. People need surgical procedures, endoscopies, yes. But the majority of issues that people have, you can talk to your doctor or the office or the PA and, nurse prac and, get your triage done. Like in that old TV show, MASH. Triage. What's coming in? What do you got? What do we have to deal with first? So it's just a great way to be able to keep people healthy.
People are also excited about the future of AI helping with this process.
Yeah, it's just amazing. So a couple of years ago, and I'm an old school person who liked to write horrible notes in my horrible charts, and for 35 years of having charts, a chart was a decent idea, but sometimes they get very thick and there's too many pages. And to go over to an iPad Pro, which I have, which is amazing, and to be able to have an electronic medical record inside that iPad where I go to click on that app, I get into my big computers through my iPad Pro that I hold and carry around with me. I made templates so I can have, for a consultation, a list of things that I ask and check and, correct in the boxes. For follow-up visits, for blood work recommendations, I check off the different tests. So everything is right there in the computer. I can see prior blood work by swiping the page. Everything is right there. I use Freed, F-R-E-E-D, AI, so that when I sit with the patient, press a button, Freed is active, and I'm in the consult page for a new patient or a follow-up page for another patient, and we talk. And our conversation becomes a perfectly complete printed list of that visit. So all I have to do is copy the subjective comments, what the patient presents with, and paste objective, copy and paste, assessment and plan. And it's perfectly outlined. It's spectacular. So that's my love of AI for what I use it for. I know friends that are architects and lawyers and everybody else using it, and they love it. So I think it's a wonderful mechanism.
If used for good.
Yeah. That being said, too, the number of people that I've seen now in the past 15 years compared to when I first started in 1988 when I took over a practice, the number of people who are interested, learn, read, look, ask questions is staggering now compared to before. And people didn't know where to look. There was no internet back then, but now people are bringing up questions about all the different things that they hear about. We have great conversation. I teach them a lot. Being able to take a person who's taking random vitamins from some store and someone in the store says, do this, do that, without any blood test or without any knowledge of your body, or some people buy things online or from here or there, radio show, there's no specificity there. I know you, I examine you, I hear everything you're saying. It's all documented. We get your blood work done. We see what you're low in. I can then create these individual vitamin packs for you based upon all of that, as I mentioned before, and put your vitamin packs together. You get a box with a roll of packs for the morning, a roll for the evening, and you don't have to have 20 or 30 bottles that you're constantly fumbling around with that are not specific to what you need. So these are ultimately specific, and you get great, perfect nutrition from this. After I make the recommendation, within a month, we'll recheck to see if your vitamin D is still low, or if it's better, or if it needs to be higher. Then I could just adjust it. So the first month, you get a month's worth of them. We check your blood, and once everything is good, you can buy 3 months of the vitamins, for a bigger discount, a 20% discount or something. So we have the gentleman working with us that's coordinating all this. I make the recipe, and they get it done. So greater than anything, because you're covering every component of the nutritional picture, and you're not ending up being deficient in different things like I see with people taking the vitamins on their own every day.
Chat's quieted down a little bit.
Yep, a wee bit. 888-420-9272. I'm so used to giving out a phone number because in the radio show, it was all phone calls. And we would get 30 phone calls a show, and sometimes people would, pack it in, and I had to try to answer questions really quickly. But at least now we just don't have a time limit, so I could take as much time as I need to put the information out there. Garden City office, 516-794-0404. It's interesting. We have family members that'll come in. They'll be like the quote, they say, the guinea pig. They want to come in, do the testing, learn everything. All of a sudden you get aunts, uncles, cousins, sons, daughter, parents, husbands, wives. And once they understand the significance and the difference of what I do, it becomes so easy to figure out. You learn everything about your body and you fix. So it's a unique mechanism, and certainly we love for people to learn about it. And look at the videos on the website. You'll see some amazing stuff with stem cell therapy. So
we didn't even talk about stem cell today.
yeah, so we'll talk some more about stem tomorrow. I have a lovely lady who has been a patient for years, ending up developing a COPD and some bad lung issues. And we did stems on her a few months ago. And her daughter always comes with her, great family. The dad came in a bunch of times over the years. But we did stem on her, and she had a hard time getting from the car to the office and used a wheelchair to get into the office and elevator. And then about a week after that, doing the stem, she has no issues. She can walk wherever she wants, all over the place. She's breathing well, not using her inhaler much, so she's in a different world. I got to see if they'll do a little video for us.
We got it.
I'll call them
Maybe
tomorrow.
We'll get them on a little Zoom action.
Yep. Yeah, so the idea is everybody knows somebody who needs help, who has a disease that's not really being treated well, that needs to fine-tune, maybe get off meds, fine-tune their vitamins, minerals, make their body healthy, evaluate better. And that's what the approach is. It's the biggest and most comprehensive approach.
And I just want to mention, for the people who know people, older people, anyone that could benefit from the, from the telehealth situation, like you just send them this website, because, the age of people watching podcasts only hits so high, but you guys, everyone that watches the show knows someone who could definitely benefit. So,
sure.
Yeah.
We have an ever-increasing older population. And I think once you get started, especially with a good eval, and we fine-tune everything, and then we have the RPM mechanism there, people already were doing this, are healthier. They're following their own steps. They're counting. They're looking at what they're eating. They're just creating better health with this guide with the RPM devices. Just makes sense. Okay, without any other questions or calls, we're down at the end of the program today.
Last call.
We have a last call for alcohol. A last call for doctor call.
Just letting them know.
Yep.
I always, someone just said I always have taken prenatal vitamins. I figured that covers everything.
No. It's good, and women like them because they think their hair does better with prenatals, but it's probably more the hormone fluctuations occurring during pregnancy. But even people taking prenatals, and you can take gigantic vitamins from other recommendations, I still see people low in vitamin D, low in the B vitamins. Most manufacturers, when you go to a regular vitamin store, will put a lot of individual things in a bottle, so it looks like it's a lot, but the tiniest doses, so you're not getting enough. That's why the blood test will tell us all of your vitamins, where the levels are. And in most cases, overwhelmingly, have to push that up. And then recheck you to make sure that our recommendation is perfect. So that's one of the more important parts of the whole vitamin recommendation. Alrighty, friends, thank you for listening. God bless you all. We'll be back here tomorrow at 12:30, live, happy and peppy, and bursting with love.
2:30? 12:30.
What did I say?
12:30.
I meant 2:30. Need more vitamins today. 2:30. Tomorrow we'll be here live chatting with you, and hopefully our Rumble is back.
Well, they're back now, but we definitely took a hit from the attack.
Okay. So yeah, tomorrow at 2:30, and we'll love to chat with you. Get your pen and pad ready. Write some notes down. We'll refer to some articles that you can read. We didn't go over the methylene blue today. We'll do that tomorrow because we'll have everything set here. And the NAD we'll talk about. Yeah, we'll just kind of freewheel it. I'm going to do a lecture at the Marriott Hotel, and I might as well start mentioning it now. I used to do this off of my radio show and announce it, and 300 people would show up at the Marriott. We would do it It's someday during the week, sometime Saturday afternoons. But I'm going to look at the schedule at the Marriott and see if for the next month or two we can get a room in the afternoon. I may bring Amy, who's our friend, the nursing company, and just do a nice big lecture for a couple of hours at the Marriott and see. Want to be able to see how many people we could get. So we're going to ask people to either call in here or call the office and just sign up for it as we've done before. And we'll see how big a room we can get. And it'll just be an open forum. We'll talk about anything and everything. So I've done that a ton, so we'll do that again. So keep that in mind, and we'll chat about it more tomorrow. God bless you all. Bye-bye now.